Hi, I'm Dr. Bobby Choker, cosmetic and implant dentist. Come on a journey with me behind the scenes where you see what happens in my life and in my clinic.
Good afternoon, Dr. Bobby Choker's Dental Clinic. Sarah speaking.
Yeah. Patients come in and just for them to get here is a big step. And if you're a good clinician, you've got to put yourself in your patient's shoes for like even 1 second. It's just so you can feel what it's like to be that person, and everybody's scared of something. So ultimately your role is not just what's in there, it's actually get the patient all the way through and making sure that each thing that you're doing is making sure that you're building that relationship with the patient of trust and everything else, so that they can feel that I'm not going to be hurt in this situation. I'm not, when you're told that I'm not going to be hurt and then I am hurt, that type of thing, is that building that trust.
Hi, my name's Derek Wilson and I'm here to start some implant treatment on my front two teeth. I've done the hardest bit already, I'll say.
Okay, so
it's probably something I should have done many years ago. However, I've got a real fear phobia of dentists, and it's only when I came to Dr. Choker that the way that he took me through in a very simple forum and very clear options about what was available to me, that I felt comfortable enough about being here today. He was very friendly and he was aware of my anxiety right from the start, even though I didn't have to tell him that. So I'm very confident about what's happening today. Will you be putting the plate, or will that have to heal for a period?
No, you can put the plate in straight away. So when I take those out and graft it, I'll actually adapt the plate so that it fits in straight away. I don't want you to be without teeth. And it means you can go off and then you can smile again and then you've got your teeth back, almost instantly. Okay. Brilliant.
My wife will let me take it for coffee now.
Brilliant. Dr. Jones.
Dr. Jones, how
all
are
yours.
Yes.
Dr. Jones is our sedationist. He can provide twilight sedation, meaning that you're basically put into different levels of a very drowsy state.
Very quickly. He brought great veins with him.
Although the patient's sedated, ultimately want to treat them as if they're awake and with the same gentleness and same delicacy, so that we make sure that they're comfortable at all times. There are monitors, so that there's no way, which is a fear that some of the patients have under sedation, that they may be in pain and we don't know about it, and because they're under sedation they've got no way of telling us. That's not possible. So Dr. Jones has obs and monitors, and he's measuring everything, including the heart rate, blood pressure. So quite often we know about it before there's actually even been a response in the patient, and we'll adjust things accordingly, so we keep the patient comfortable at all times. So now we're going to build that back up again. And that's the denture there with cloths to hold it on. There we are, the patient has 2 front teeth. Have a seat, it's okay. Make sure you're okay.
Yeah.
All right?
Okay. Thanks, Bobby.
Pleasure.
Excellent.
Very welcome, okay?
Thank you.
One of the things that we deal with here every single day are phobic patients, various levels of phobia. Some people wouldn't regard themselves as being phobic, although they are. If the thought of the dentist or something clinical scares you enough for you to be having sweaty palms and stressing and increased heart rate or sleepless nights, then you're definitely at some level a phobic. We pride ourselves here on the fact that we treat these type of patients and treat them efficiently and comfortably so that they feel comfortable and secure at all times. What we tend to do first is build a relationship, so sit down and talk about everything that the patient may need, and just listen to them, listen to what their world is like, what is happening in their world. So we actually really listen, not just sit there and just hear words. We're listening to what life is like for them on a daily basis, how they feel, their emotions, and based on that and what their needs are and their condition, we make a plan.
When I had my teeth, I was always taking photos and I was always in family photos. But when I lost the teeth, I never wanted to smile. I was just used to smile with my mouth closed, and just stopped taking photos. Because it was really upsetting knowing I had a tooth missing and I didn't want to smile, or I'd hold that side and smile, but now I don't have to hold it anymore. So it was really good when I came here 2 weeks ago and got my tooth fixed, so that was really good because your smile is everything. It's amazing what a tooth can do. Like when you have one missing, it just doesn't look very attractive. So yeah, so I'm just happy to have my teeth back.
Happy patient, happy dentist.
Oh my gosh, yes.
Unfortunately, we live in a society that's
I know.
quite fickle.
Yes.
Okay, so appearances matter, and you know that affects people. So I understand why that's important. And
Yeah.
to be honest, it's self-esteem as well.
It is, 100%. And if I was at work, I was in retail, if I was talking to a customer and then I see my reflection in the mirror, I just go, oh my God. Yeah, I didn't like it.
No, life's too short not to smile.
Oh, that's for sure, that's for sure. Like it's just really good just to have that. It's amazing how much of a difference it actually makes.
Do you know what we're doing today?
No.
Okay, we are removing that back molar, the bad one,
Yeah.
the back right. I always say you may feel like a little scratch coming up, but people rarely do. So, you okay? Already done. We're going to start with just some pushing, okay? Just some pushing. You're doing very well.
Stubborn too.
It is. It's all right. It's because it's got 3 roots pointing the other way. I
It's
didn't.
because it's a back one, or?
Yeah. The tooth we took out the roots left some holes, and what we're doing is just filling up those holes basically. Bingo, that's right in the middle. Did you feel anything? Was that all pain-free?
Yeah, it's painful.
Good.